Hello, everybody. Thank you for joining us for Data Ethics for All Live. Today, I'm with Kandyce Jackson, who is an attorney focused on data ethics, cybersecurity, and privacy. Hi, Kandyce. Welcome to the show.
Hey there, how are you? Thank you for having me.
You're very welcome. We are so excited to have you. Today's topic is so, exciting and so relevant into what's going on today and what we are facing with COVID-19. So, the importance of open government data in times of crisis is such an exciting topic. I want to learn more. And let's dive right in.
Yeah, definitely. Let's do it.
Tell us a little bit about your background and how you got into this space.
Okay. So I have been doing some type of tech work for almost 10 years now, feels weird to say. But at first, it started off from the time I was in high school doing some science and tech programs to going to college and being an IT major and studying multi platform journalism. I just kind of felt into a love of startups. And as I progressed through my career in IT, I came up against HIPAA issues, which is like a healthcare law here about privacy, and like it became a part of my job to help make sure that we were keeping people's data private. So when I went to law school, after doing IT for 4 years, the first thing I started to see in like constitutional law class was privacy issues related to data, and it kind of just dawned on me that maybe big data it was an area that I want to be focused on, that privacy was something that was super important to me, and that's how I would get there. As far as caring about open data, that's something I was able to learn about during some work that I've done on smart city projects. A lot of that work is trying to figure out how to optimize your smart grid, like in terms of like climate change, or just in terms of being able to survive a natural disaster or some other crisis, and being able to shift resources like hospital resources from one side of the country to another, or one side of the world to another. And throughout that process, I realized that open government data was something that was super important and something that some countries have been working on for a while and others were slow to adopt.
Absolutely. Yeah. So, what exactly is open government data according to you?
According to me, open government data is it means that you are collecting certain data as a government entity, and that by default, most of that data should be considered public unless there is and freely available to other people unless there's a valid privacy, security, or privileged reason for which the data should be kept private. The goal with this is to make sure that as many people as possible can access that data and use it for the public good, and even for private good, because I mean it'll help with you know making sure your government contracts, that when you put in a bid, your bid seems like it's probably going to win based off past figures and things like that. So both private and public good come from keeping open data, and it also helps with in terms of making sure that you have like a complete and accurate record of like your infrastructure, your spending, so that you can make sure that all of the money and resources that you're moving around in a crisis, especially, are moving to the right people.
Yeah, that makes sense. So, how do you think that we can make use of open government data to help this crisis that we are in for COVID-19?
Okay. Well, if we're talking about COVID-19, let's think about what open data is in terms of like breaking it down. What I want is data that is complete. That means that it's all public data. That's not subject to a privilege. That's data that's primary. I collected it straight from the source. That means that I'm collecting data from the hospital that identified the patient with COVID-19. I identified the grocery store where this person worked, and I was able to identify the family members who that person resides with, so that I could contain that outbreak. It's timely. I get the data quickly enough so that I can act on it before that person is able to move around the city and spread the virus. It's accessible. As many people as possible, such as doctors and government officials, can access the data in order to use it to inform their strategy for responding to the virus. And it's machine processable. We're moving into a world where we want to be able to use AI and other automated decision making and calculation systems. In order to be able to do that, we all need to be deciding what is the format or formats that we're going to be using to make sure that we know that this data is relevant, why it was collected, who it was collected from, and what any limitations are on how we can use, or the usefulness is of that data. That's important for the virus because, I mean, it doesn't help to know late or a little bit of information about the spread of this virus is very big. It's hurting a large swath of the community. So the faster we can identify issues and act on them, the better. Making sure that we can do that in a machine readable and like a computer assisted way, that's super important. And then non-discriminatory, you want to make sure that anybody can get access to the data, regardless of like patent or trademark things. So what that means is we want to make sure that it's important for the data to be government data rather than private data, because private people are going to want to, get intellectual property rights, which sure, let them do that. But if the government is the entity commissioning the work, it should be open and free for other people to use for the public good. We don't want the government to pay for data to be collected and then to be hidden behind the doors of people who don't want to share it with other people when there's a big crisis going on.
So I want to go back to something that you mentioned, that it has to be collected directly from the source, right? The collection of data, the source of the data here would be very critical. And you are mentioning that it shouldn't be a third-party source, not an aggregated data. It should be collected right from the source, from the hospitals who are patients who are infected by this, the grocery stores where they shop, their family members. So, I mean, that's right, because one of the major concerns in data privacy is the consent of data. So the collection of data, how the data is collected, and the power of somebody holding that data. So somebody who has collected aggregated data from third-party sources, if they are holding on that data and asking other people to pay for it. So I think there are two issues here we're talking about. So first, I want to talk about if we are going to go directly to the source and get their consent to get the data, in times of crisis, that's going to take longer. Like maybe hospitals, you can get it, but then going to the grocery store, going and talking to their family members, getting their consent to get that data, then to put it in a system where then it can be used using artificial intelligence, machine learning, and then use it for model making and suggestions and predictions. That all process is going to take time. Uh,
Mm-hmm.
how do you feel that you can solve that challenge by getting the data quickly from the
So
well?
I think it's important that we not equate the need to move fast with the need to like disregard policy privacy. It's really important that we put in place the strategy, like implement the strategy, the open data strategies that are necessary to make this something we can do faster. So, for instance, in the United States, the Department of Health and Human Services has for years been trying to get its healthcare providers and those people who like get federal government money to move over to electronic record systems that would allow them to be like meaningfully used to, so that like no matter what hospital I go to, I can carry that data with me. I can carry that consent with me, and I can give consent myself as a person, like from an app on my phone, for example, or right there in my doctor's office on an iPad they provide to me. It's
Versus the insurance companies holding that data or the hospitals holding that data, you're saying.
So that data, it gets dispersed in a lot of different directions. I would say that like the hospitals may have the data, but those would be the healthcare entities where I personally might feel more comfortable giving that data to a healthcare provider because I know that they're covered by HIPAA, and they have to protect my privacy to a higher extent than say my insurance company.
Sure.
So I think that folks would appreciate the ability to say, look, I was infected by this virus. It would be great if I go on Apple phone and say, hey, I was sick. I have a fever and I have 180 degree, and that can go straight to my doctor. And my doctor can register me preliminarily as someone who needs to get a test, put me in line for testing in terms of do I have COVID and how severe my symptoms are. But right now, we have this big, like, kind of blob of a response where the data that folks are collecting and using to do models for how long we'll have to do social distancing and like how fast the virus will spread. It's all coming from different directions, and we don't know who has good data and who has bad data, especially because we don't know where it's coming from, and we also know that some places are underreporting or misreporting or
Mhm.
reporting late deaths and things of that nature
True.
related to the virus.
Not reliable data. So this is a great question. This is a great point that you mentioned. So you are saying that the individual themselves to enable open government data. If I have COVID-19, I should myself be able to have all rights to my data instead of asking my doctor or my hospital to release that information. I should have complete ownership on my health data. And I should be able to um, use that data and make my data available to government so that they can use it, anonymize their data, and make it available for them to be able to use it to find a response quickly.
Exactly, and there are already, I know, and I'm speaking from the context of the United States because that's where I'm based. But there are already systems in place where we have public health laboratories that are supposed to be helping to like identify certain like birth defects and other illnesses. So like, and they're mostly at the state level where the state will have certain diseases or like defects that must be reported immediately. And so you'll go to the lab, they'll take your blood or how whatever sample they need. Those results will go to a lab that looks for a certain disease. And if it's important and it needs to be reported, it'll go to the public health laboratory. The public health laboratory will let the state governments know. Now, that's a lot of steps in between,
Mm-hmm.
but it shows that this is something that's not new or novel. It's something that's been slowly rolled out in part because of something else we discussed earlier, which was is the data open and available and non proprietary? Does
Yeah.
somebody have intellectual property rights over it? Does somebody have an incentive to not allow their competitors to get the data? So I know that recently, I want to say maybe like a few months ago, organization name I want to call them Sequoia was awarded a contract to help build out a more systematic approach to collecting that data,
Okay.
and so there are going to be I want to say 5 different uh, health health information networks that
Okay.
are like supposed to be helping to move this type of data around. And that's exactly what we need right now for in terms of figuring out what flattening the curve looks like, where the
Yeah.
virus is, and things like that. But and open data helps on the health side, but it also helps on the infrastructure side because, for example, one place where you can find really good data in the United States is the U.S. Treasury Department. They have one of the best open data platforms from as an agency of the United States. It's very organized, and you can go up there and you can find a lot of data about infrastructure projects that have been done. A skilled data scientist and working alongside lawyers and people from heavily impacted communities can go through that data and figure out, okay, where do we need to target mutual aid? Where do we need to target other government resources? And
Mhm.
like that's something that's open and free that they can be using together to do that work. So being able to access data in this way not only helps with the direct addressing the virus, but also with the how do I distribute stimulus funds? How do I make sure that the right people are getting medical supplies? Because I know for a fact, for example, a lot of African American communities have been heavily affected by the COVID virus, but we could see that coming because those communities usually only have like one hospital. So, for example, in Washington, D.C., there's a big mutual aid effort to help folks get food that they need. But it's one thing that is hard for mutual aid to help with is the healthcare system because, for example, wards 7 and 8 of D.C., those are like the breakdowns of the city. There's 8 of them. Ward 7 and 8 only have one hospital between them and like maybe like one grocery store between them, and that's a very large population of African American folks. So you know
Mhm.
that those areas are going to be hit the hardest when there's a big wave, and we're trying to figure out where the ventilators are. Well, are there enough hospital beds for all of the people who live in those wards?
Mhm.
Are there enough ventilators for those people? Probably not, but because those areas were already under resourced in terms of just groceries, bare minimum, like transportation and things like that. So you need to make sure that you're directing resources to people who are already vulnerable because of systemic things.
Yeah, no, that's a good thought. I mean, definitely that would help a lot, right? If we could pre-conceive and pre-understand where could the hotspots be, because these are the most vulnerable communities, and they're likely to have, the infection of the disease. It's probable. And if we could predict that and provide resources ahead of time, or even make sure that we are taking enough precautions that this that doesn't happen, then that would be an effective way to minimize the crisis.
Definitely.
So I want to talk about how many governments have implemented these open government strategies so far.
So no government has completely implemented a great open government strategy. There are places have done like piecemeal. So in the United States, like I said, the U.S. Treasury Department is someplace where if you go to their data.gov, it's usa.data.gov, I believe is the website. You can go there and like you'll find a treasure trove of information about government spending. One of the great places to look because, for example, we're doing a lot of spending right now to try to save people who are being harmed by like the economic crisis. So figuring out, looking at that data and being like, look, what projects are we spending money on? How can we work with the companies to make sure that with all the spending we're doing, one of these 22 million people who's been recently unemployed is getting the money that we're spending on bailing out whatever companies we decide to bail out. We want to make sure the resources are going to people who are going to boost the economy, right?
Yeah.
So, and then you can also look at another country that's done, I think, a really good job of demonstrating some of the foundational things that are required. Australia, in 2008, when we were bailing out like financial services and things like that in the European Union, a lot of money went to smart city projects. And one of them that did a great job in terms of open data was Australia, where the first thing they realized was what everybody realizes when they have to learn how to use data is that they have a bunch of data that they didn't know they had. I think this one number is like you only use 3% of the data that you actually have access to, and you probably don't even know you have the other 97%. So they realized that. They realized they had to clean up all those data, and that was a massive undertaking. It required interagency support throughout the government. And then in order to like show folks that like all this work that you helped us do was worthwhile, they not only had to like clean up the data and put it up, they also had to do this massive undertaking where they showed people how good this data was. So for instance, I think one project they did was with grocery stores, grocery like farmers markets. There was an agency that gave out permits for grocery and like farmers markets and things like that, but people were committing fraud and things like that and like pretending like they had a permit when they didn't. And it was a paper-based system. So the people in Australia who were leading this program go to that agency and say, hey, let us help you fix this problem. They create an app for them, and they use that app to distribute the permits and to like collect payment. Not only that, by virtue of collecting all of the data from from like those permits, they were able to help people say, hey, look, this farmers market is full today, but guess what? There's some space over in this other farmers market, and also there's no competition over there for you in terms of the exact products that you're selling. So they were able to show, hey, look, I fixed this problem for you, and also I helped you make this service delivery better for other folks. So I think that in terms of talking about open government data and who's implemented a good strategy, I think that the United States has a good federal action plan, and you can go and look that up online. It's a great detailed plan that shows all of the heavy lifting that is going to go into making our government data open. And then you can see like some products of the past work, like the Treasury Department, where like the data is up there, but in terms of showing people how to use that data, like Australia did, we haven't quite gotten there yet. We need to figure out how we're going to get folks like the Treasury Department to like go out like, look, we did this great work. Let me help you, other agencies, so I can convince you that you should do this work too. And so like not everybody has done that type of work.
No, I agree with you and sort of disagree also at the same time because this data, there's just so much data, right? I know that we have in America, we have had this open government data and we've used it for like brutality crime. We've used it for the smart city project, for finding parking, like similar to the farmers market. I think the San Francisco city has used it to find parking meters and creating apps where, we can tell you that in this area, these are the parking spots that are full, but you could go to another parking spot where it's available. So there's a lot of use cases of this data. And I agree with you that there's just so much and there is a detailed plan, but now we need to come up with applications to leverage that data. And in terms of crisis, this is like critical because it's not like a defect or a parking meter where, it can take time for us to come up with a solution. The time is now. We need a solution right now in our hands, right? Um, Another question that with open government data, with any data that's open, privacy is a big concern. And PII, the personal information, is another very big identifiable information is an important thing to consider. So how would government data preserve the privacy of the individual while being able to make that data available so that it could be used for social good. What are your thoughts on that?
So I think one of the big factors that folks overlook is trust in your institutions. So I think that in terms of, if we take it back to when we were talking about health data, when I said that folks should be able to like hold that data and be like the complete ownership with it and decide who to share it with, I think that applies in all contexts. And I don't think that open data means you can use everybody's data no matter what. I think it means that everybody who trusts you will let you use their data. And I think that both the government and private industry should accept that. It should be people who trust you will let you use your data. If
Mm,
you have to fake or force people to trust you or feign trust for you, then
mm,
that's not
not-
what I'm talking about.
yeah. So there is some talk on geolocation data being available to the government, like data from their big companies and enterprise, social enterprises, and big companies who are helping in this effort, like Facebook, Google. They talk with Microsoft and IBM, who are who have this data, whether it's through mobile carriers, through the geolocation, or Facebook data, where they know where we are from, what we are doing, what kind of actions we are taking, and Google, this type of searches we are doing. If I have COVID-19, then Google can tell that, the kind of searches I'm doing, where is the nearest testing center, what do I need to do, what are the symptoms, all those data points, whether it's searches or I'm asking my friends for advice on Facebook, or my geolocation shows that, I'm near a hospital, or I'm near a lot of people with where it's showing hotspots. Those are all information that could help identify that this hotspots in the crisis, and help us figure out a solution for it, or even people who are following shelter in place or not, to make sure that they are doing that. But at the same time, there is this big discussion in the data ethics community as to what is ethical. Like, is it okay for these companies to share that kind of data with the government?
No.
Um, yeah. That's where I'm going with this, right? So first they're collecting this data on us. We are obviously giving them consent, whether it's explicit consent or understood consent. Where you have this data, and now they are sharing this data, agreed that the intention is to use it for social good. But who is going to validate that it is going to be used for good? It's going to be used the way it is intended to be, and whether this flow of information is not going to hurt individual privacy or violate individual privacy, and then it is going to stop when the crisis is over. So, what are your thoughts on all those things?
So I don't think that anyone should share other people's data without explicit consent. I don't think you should even have anybody's data for longer than it takes for you to conduct a specific transaction with that person without their consent. I think that all data use and collection should be like treated as a privilege by the entity collecting it, by the person collecting it, and you should recognize that it requires trust for people to want you to have that data. So on the day I stop trusting you, I should be able to delete it. And that right there incentivizes you to be a good, that incentivizes social good. If I know you're doing social good and I know you're not, and you intentionally trying to deceive me or defraud me or, sell me bad credit via advertisements or whatever that may be,
Yeah.
then that's one thing. But on the day that you cross the line, I should be able to delete that data. You should have to, recognize that you've crossed the line.
Agreed. All of those things in general scenarios, yes, that is a debate for like data ownership, and who owns the data, explicit consent. All of that is in the regular, when everything is normal in the normal world, in the ideal world, all that is important. And institutions who collect data need to be careful about uh, getting explicit consent before they share the data with anyone else. But in the times of crisis, that definition changes, right? So I'm
Nope.
specifically asking, no?
No, it doesn't. But so we don't want to give up civil rights that we worked really hard to get. Right? It took a lot for us to get these civil rights. The right to privacy, we got that through a big war with England. It was a very expensive war, and then we had to come back from that, and like we were this scrappy little country that was like, we're gonna have privacy, and then we're gonna be great. And so we don't want to give up things that we fought and like shed blood over. We like a lot of folks have shed blood over whether or not we're gonna have any privacy laws at all. It took forever for us to get a comprehensive one in 2016. And that was only after years of pilfering data from us and not really like pouring anything really positive into the people who you're taking that data from, and not really doing the things you're supposed to do to protect, for example, democracy. Uh, and so we want to make sure that we do not think that just because we're in a crisis, we give up our rights. No, when we're in a crisis, it shows you should have been doing this in the first place. You should have been doing things right in the first place, because then we would have been ready to, respond in a way that protects privacy. If, for example, companies had, and the market had adopted electronic record health record systems in the comprehensive and meaningful way that the government had expected it to do in the United States, then they would have been ready already for this, because there are already there are already like schematics, like NIST has schematics for how to do a open health information network. They're up and they're not new. And so the market could have picked those up, and they were supposed to pick those up over the last 10 years, over the last 5 years especially. And there's even more money being poured into it, but they've rejected it. That's not my fault. I don't lose my rights because you refuse to do what the government told you to do in the first place. You get a 10-year head start is what I say.
Yeah. And if so, coming back to that point, like if Facebook or Google or any of these enterprise companies who have huge amounts of data, personal data collected from our experiences, our activities on these social platforms, then would it be fair to say that if they do want to share, instead of just sharing that data with the government, maybe they should first ask explicit consent from people, and then they should, like to your point, make it available as open government data instead of giving the access to a few select people who can take advantage of it or misuse it? Why don't we make it available as open government data, and then if people want to use that for social good, build apps on that data, or so that the number of people who can take advantage of this data and help the community is larger than a small set of individuals or even the government who's obviously trying to do good. Would that be a good way to solve this problem, instead of just giving the government the data?
Yes, I think so. I think so, like to a great extent, and I will say that because I'm thinking about, for example, all of the mutual aid that we're seeing happen throughout the country. DC is at the forefront of my mind right now, because they have a network, the DC Mutual Aid network, that has been just like collecting information from folks like via social media and via like other chains of communication, and then going out and distributing medical supplies, food, all of the things that folks would expect the government to be doing, these DC Mutual Aid Network is doing, and they did it fast. I think there were reports that the DC government was actually directing callers to this DC Mutual Aid Network because their work was so good. So imagine we those folks with access to the data that these bigger places have, and being able to respond very quickly. That takes us back to the importance of granularity. Like the people know what the people need, and so they're able to talk to each other and get it going quickly, versus like government bureaucracies.
Correct. Yeah. And like Facebook, Google, they have massive amounts of data, and if they could we could leverage that data and help niche communities, then so many other individual as well as foundations and organizations could help and be resourceful to and provide the exact resources to the right people and in record amount of time, instead of waiting for someone else to do it for us.
Exactly. And I think that it even takes us, like, I think one of the bigger obstacles will probably be something that's in the 2020 federal data strategy right now. It's that they need to not only figure out what data they need, but then also figure out what kind of upskilling of their employees they need to do, because we know for a fact that we don't have the workers that we need. If you go and you talk to folks about, can I find a data scientist? Can I find a person who knows AI and can do both the development, the front end, the back end? Do I have social scientists? Do I have historians? Do I have sociology and anthropology folks who are going to be able to work with and be fluent in those types of things, so they can work with those people to do good work? at a nonprofit, like nonprofits can't afford those people. They can't, and like also we don't have the widespread access to the education that's necessary to do that, right? So in the federal data strategy, part of it, the work is to put up modules that will teach for each agency to figure out what data skills their employees need, figure out who's going to get it, and then put up modules on the websites where folks can just access those and learn those skills. So I think that's something that will be important in terms of making sure that people can leverage open government data. If DC Mutual Aid was going to use open government data right now, they would probably have to rely on the kindness of some person who happens to know
Yeah.
AI and mutual aid, or AI and care about mutual aid, or data science and care about mutual aid.
Yeah.
Whereas if we made this a widespread thing, which we should, because I mean, if data's the new oil, then people should be able to drive, right? Like, so you would use the data.
Yeah.
So like, if these folks were able to, on a widespread basis, like leverage open government data themselves, they would be able to respond in an even better way. And we already know they would, because they're doing it right now in the ways that they can.
Makes sense. Yeah. So, any other challenges that you think we have not covered in, implementing an open government strategy, government data strategy?
I think we talked about pretty much the big three. The big three, there are many challenges, but I would say the
Yeah.
big three are intellectual property over the data right now. So, like, who owns it, and are they going to make it open for everybody to use? Workforce development, who can use the data? I've even talked to folks at the Treasury Department, and it's something that I really want to do, is to put together a data for lawyers class at my alma mater, Howard University School of Law, because I feel like this is both a civil rights issue as well as, like, just being able to use the data issue. Like, we want to make sure that we have people with a civil rights mindset, like keying in and understanding something. So I've been talking to people at Treasury, trying to figure out how we can like collaborate to teach this to lawyers, like, because it doesn't help if only like a certain subset of folks who went to MIT, for example, or who went to Stanford, who went to whatever, they can do it, and like only
Not everyone can do it. Yeah.
but not everyone can do it. So we want to make sure everybody can do it. So working with folks to figure out how we can take those skill sets and get the open data in the hands of as many people as possible. So that's workforce, and then the last one will be the big lift of cleaning up our current data and deciding what's good, what's not good, what's discriminatory, what discriminatory means, and how we're gonna overcome those barriers.
Wow. So, and speaking of which, the top three that you mentioned are right on spot, and that's why we started Data Ethics for All. We don't want any privileged class to be able to just understand and use data, but not only use data, but also understand the ethical considerations of data, and it should not be limited to somebody else, one particular class. And so I invite you, and I like your idea of creating a course or a standard, whether it's for lawyers, whether it's identifying the gaps. And we are trying to create courses ourselves where, it's open for everybody. And we are trying to educate people, whether they are in an organization or whether they are using data as a person, like their personal data, they're sharing their data. Both of those need to be aware of how data is, collected, how data is used, how we can make sure that we are not violating any privacy and ethics rights of people. Like you said, it has taken us a very long time to get our civil rights, and we want to make sure that we keep them intact, right? So yeah, I think this is a great discussion, and I invite you to join the community, keep in touch, and continue the conversation. And I
I
invite
will.
everybody who attended today and are going to watch the replay of this also to participate in this very important discussions, and help us lead the way. So
Yeah.
thank you, Candice.
Thank you.
Sure, take care. Bye bye.
Bye.